Hey everyone, welcome back to the BioNexus Health podcast series. Today is going to be another helpful Q&A session with many moms from the UK and other countries in Europe. So be sure to join in and let's just jump right into it. Hey, don't forget to subscribe, right? You know, that is very helpful and quite motivational for our staff to keep putting out these helpful podcasts for you. So don't forget to subscribe and let's jump right into it.
Welcome to the BioNexus Health podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie A. Dashore.
One important thing to remember, guys, those of you watching, remember to watch part 2 of this podcast. This is going to be in 2 parts. There are many parents, I said moms, but this is going to be many parents of special needs children from UK, Romania, Germany, France, Belgium, that will be joining us, and other countries in Europe. And I'm sure, each one of them is going to have very interesting questions, and I will be providing in-depth answers. So just be sure to watch part 2, because it's going to be a pretty long podcast otherwise, right? But I do want to help as many special needs, autism, and other special needs, like genetic, CP, Fragile X, etc. So there are many children suffering from many different conditions around the world. And this is a small attempt to help those families. So be sure to tune in to part 2 as well. Morning, Alexandra. Good afternoon to you, actually, in Europe. How are you doing?
Morning, Dr. Dashore. We are very, very well. Looking forward for our meeting today.
Very good. Good. I'm glad to have everyone here. We have quite a few who have joined in.
Probably we're going to have more because people are just gathering now.
Okay. Yeah. So we should give them a few minutes. I mean, I guess we can get started, because this is being recorded.
Yes.
And so, right, for the benefit of everyone, in case they want to revisit and watch this again, and plus for other families who were not able to make it today. So we'll make it available.
Definitely.
All right, very good. So I'm going to leave it up to you. You have the floor, Alexandra. How would you like to proceed?
I'll start slowly, and if they will connect, then maybe
Okay.
I will address and I'll say their name along with a question.
Okay, so this is a question from a mom in Italy. Go ahead.
Yes, she lives in Italy for a very long time, and she's got an adult child with severe autism and genetic conditions. So her question is there hope for the genetic autism, and especially at this age, because her daughter is over 20? Is there hope? Can we look into treatment? What would be like the solution, or where should we start for an older person with symptoms, and not just symptoms, genetic condition as well?
Right. Well, one thing that I want to say right off the bat is that there is always hope. This is a mom fighting for her child.
Definitely.
And, when children are diagnosed with genetic conditions, when I shouldn't say children, well, yeah, your son was diagnosed, your child was diagnosed when they were younger. But, when there are genetic issues, when there is issues like autism, cerebral palsy, other, right, motor neuron disease, Guillain-Barré syndrome, any other kind of childhood problems, right? Juvenile diabetes, juvenile arthritis, other genetic issues like Fragile X. What I've seen in my practice, now remember, my background specialization is pediatric neurology. So, I've seen a lot of these cases, even when I transitioned to the naturopathic practice. And what happens is the genetic condition affects many systems in the body, right? It can affect first and foremost, your immune system. It can affect your neurological system, your kidneys, your liver, your detoxification systems. So all of these over the years get more and more compromised. So it really doesn't matter at what age you start treating the child. It is important to customize the treatment to the child. What are the genetic issues? What are the labs showing us right now? What is the state of all these different systems? I often find, the muscles, the joints, the bones, the back, the spine, all of these systems or all of these different issues in the body of children who become adults with chronic, long-standing issues. So there is absolutely hope. The oldest client on the spectrum that I have treated has been 36-year-old Rachel from California. I might have spoken about Rachel. She is, her mom's and my pride and joy. Her mom was 65 when she contacted me, and very anxious, but very hopeful. At that age, she was very hopeful, single mom. And Rachel was in very bad shape. Not even properly potty trained. Just to imagine, this is the work mom had to do. So Rachel improved a huge deal to the point where she and mom, the aggression is gone, the anger, the destruction, the potty training is fine, the gut issues, the diarrhea, these are all resolved. She is dressing, bathing on her own now. So this is, she even goes, shopping with her mom. And it's been life-changing. And mom never thought until she heard me speak at one of the autism conferences that, it was indeed possible.
Thank you for that. You already answered my second question, as the same mom was asking if there are hope, because she's like old now and she's having like severe insomnia, and as well is having back problems, joint problems. So you already answered the questions with this disease that is affecting all the systems, basically. Another question is, does congenital Lyme exist? And is there a link between congenital Lyme and autism?
Congenital Lyme exists. There is a lot of research studies that have been conducted on this. I am a living example myself. I know many of us are here in this group. And who have done the research into this. Now, I first learned about this from, God rest his soul, Dr. Charles Ray Jones was the #1 pediatric Lyme specialist in the world. And, I mentored with him for my Lyme disease education when he was treating Brian. And it was eye-opening. He shared his entire PowerPoint presentation that he had recently presented, and I studied it. And, yes, Lyme disease can be sexually transmitted from mom to dad, dad to mom, and then from mom to child. Yes, it does cross the placental barrier, and the child can be born with Lyme. I've had many moms who have been pregnant with Lyme, and they found out during pregnancy, or the bullseye, the insect bite happened during pregnancy, and they were terrified, but they wanted to stay completely naturopathic. So I handled them. There is a hospital right here, Central State. I remember helping one mom who was an ABA therapist locally, wonderful, Allison, ABA therapist in the local school systems. Hers was the first case I handled actually of this. And, baby boy Colin was born blue. He was born blue. He had meconium, lots of issues right from birth. And, anything he would eat would give him allergies. Anything, any formula they tried, even breast milk. He would break out, his whole body would break out in allergies, hives. He couldn't sleep. He was constant spit up, very colicky, cranky. He wasn't developing well. She refused to vaccinate him because she knew, that would be a big problem. So because of his severe medical issues, the establishment, decided to wait for his vaccination. They were okay with that, thankfully. But so then we said, you know what, let's get some herbal and homeopathic treatment on board, and not just plain homeopathic. It won't really help, with such a severe case. So we did homotoxicology, and then we did herbal. And little Colin, amazing. His mom started him on gluten-free, dairy-free right away. He started getting better. So since then, he's had a brother, a mom got treated, she got, so I do preconception counseling and treatment as well. So anyone trying to get pregnant, especially if you already have one autistic child, or, you already have one special needs child, and any kind of problem other than autism or autism. So what we do is we help the mother completely identify and detoxify the toxins. And then usually the second pregnancy is amazing. So mom got treated, Allison got treated, and brother Adrian both the brothers are amazing. And, mom is doing well, her husband is doing well. So yes, it is. It's a reality.
As we are here on this chapter, that would have been one of my questions for a mom that has Lyme or suspects Lyme. How long before does she need to detox before another pregnancy? How long would be, appropriate to start the detoxifications for another pregnancy?
All right. Ideally, a year. But the minimum I've seen good results with is 6 months. Now, if we do testing for you and you have everything, MTHFR, CBS, VDR, and then you have diabetes, and then you have thyroid, and you have a child who is autistic, and then you have HLA-DR problems, you've been exposed to mold, you've had insect bites, then obviously, to be fair to the next child, you should give yourself a year. So again, it needs to be, that's my main philosophy is you need to treat the individual, not the disease. It cannot be, a standard protocol that, hey, all moms do this and you're, ready to have a beautiful second child. It doesn't work like that. So individual evaluation, max a year, minimum 1 month. Minimum 6 months is what I've seen.
Amazing. Thank you. Andrea from Belgium, she's asking if there is a medical cause from the sensory issues in autism, like haircut sensitivity, sound sensitivities, clothes, things like this. How can we sort them? Is there like a shortcut, or are there any tricks that we can go to sort them in a faster time?
To sort out the sensory issues faster?
Yes.
Okay. When there is biotoxin illness, there is actual damage to the gray matter in the brain. And there is swelling in the white matter in the brain. This is putting it very simply so everyone understands, without using complicated terms like multinuclear atrophy, edema, etc., right? But that is research. That is what evidence-based research shows. So as we treat the underlying causes, that is when you will start to see sensory issues get better. Remember, you have to identify the causes, you have to treat the causes, then you have to repair the damage caused. And lastly, if the problems are not getting resolved with just repairing the damage, for example, damage to the gut, damage to the brain neurons, there are herbals which can absolutely be used for that. Now, if this is not working, then it hasn't worked fully, it works, But if you're not getting, the kind of results you're seeing with respect to sensory, because sensory is a very high function. I mean, sensory integration goes from basic, right? Basic five senses all the way to really complicated, bihemispherical integration, using both the hemispheres productively, your body awareness, environmental awareness, moving the body in space, so spatial awareness, along with proper motor coordination. So sensory integration can be mild to max involved. And at some point, for some children, we may need to use regeneration. And there are herbals that can be used for regeneration of neurons. There are herbals that can be used to activate stem cells in the child's own body, your own stem cells. I mean, everyone has stem cells at any age. It doesn't matter. Your bone marrow is fully capable under ideal circumstances. Of course, if it's full of toxins and infections, then you won't see it happen. Right. So that's the reason why many transplants also fail. Many go for stem cells. Oh, this is the most aggressive. Let's do it. Sure. It's a revolutionary procedure that is amazing for spinal cord injury, brain injury, stroke, etc. And there is a reason why FDA hasn't approved it for autism yet. I don't think UK approves it as well. There is promising research, right? But it needs to be done systematically. So mom and dad's hard-earned resources and time and money and travel and what have you, is not wasted. So ultimately, when we go to the regenerative state, sorry, I just took a little detour, but in the region, because many ask me this question, so I thought I might as well address it, So regeneration is entirely possible. Your body's own stem cell activation is entirely possible. Everything has to be done at the right time. Yes, well, Andrea from Belgium also asked, are there any shortcuts? Yes, not really a shortcut, but something that is complementary. You can do sensory integration therapy, and we can customize that to your child, because so first, what you need to do is to get a sensory integration evaluation done and then send it to me, right? And then based on your therapist's recommendation, I will say yes, no, modify, adjust, do this. So this will be customized because yes, I mean, as you know, I'm sensory integration certified for many, many years now. Decades. So this is something that I'm planning on including in my book on autism, which should be coming out next year. But yes, it is entirely possible to expedite the recovery.
Great, thank you. There is another question. What could be the cause of autoaggression, sensibility to light, refuse to walk, and pain in legs? Would they be associated with Lyme? Would they be associated with the autism and comorbidities? What would be the source? Is there like a common source for all these symptoms?
Yes. One common source is infections. So that is something, and of course, I think that answers all the other questions. Is it Lyme? Is it autism? No, it's not autism. Autism does not cause pain in the legs. That's just, absolutely ridiculous to believe that. If you have a child sitting in the corner, holding up his legs, I've heard these stories from many across the globe. And I remember actually recently interviewing a mom from Pakistan, I think. And she mentioned, her son used to sit holding his legs up and just refused to walk. And, people just blamed it on autism behavioral issues. So oftentimes, and again, there is one research study on this, which was published in 2012, I heard about this at a conference that I was speaking at as well. And since then, I'm sure there's many, but I haven't kept track because I already know. So children with autism, in a special needs school, it was a special needs teacher who conducted it along with a renowned Lyme doctor here in the US. And the reason why the teacher did this was because his own son was on the spectrum and he wanted to see what he could do. So they started treating children for Lyme disease who had the symptoms of Lyme as well. Long story short, the head banging stopped. The hand flapping stopped. And when these children were also treated for mold toxicity, additional symptoms got better. So, understand that hand flapping, right? When someone has, for example, how your leg goes to sleep sometimes, and then you just bang your leg on the floor, you bang your foot on the floor, trying to kind of, wake up the leg. Similar neuropathy kind of symptoms happen with Lyme disease. And these children were just trying to wake up their arms and hands because there was tingling and numbness felt. And the children that had underlying infections and comorbidities, they lost that symptom. And it's, globally known as the classic symptom of autism. I don't think, in today's day and age, with where the research has come to, my own research has come such a long way, along with other, practitioners who've established research in this arena. It is just absolutely ignorant if you think a lot of symptoms that are, just said, oh, this poor kid is autistic, so he is going to bang his head. He is going to bite himself or hurt others or destroy furniture or break the walls. I mean, I had one mom recently, a 12-year-old untreated, severe PANDAS, huge flare up. She ended up in the ER with her son because he just, he started breaking windows and walls because that was not identified. The PANDAS was not identified, and somebody in the family got the flu, and that's it. Severe flare. So, it most certainly is not. You have to investigate why these behaviors are happening. Is your child in pain?
Now, because we were talking about flares, how should we proceed with very long flares, and how can we boost immunity for the cold periods, or is boosting immunity a good idea when we are talking about PANDAS, Lyme, autoimmunity disease?
Well, long flares, we'll have to do individual information on that. That is, it depends on each individual child, what the underlying issues are. We run the labs, we investigate. So if there's a long flare, I can answer in general, but yeah. Obviously, I cannot give out treatment options right now, what to do, but yeah. Okay, so what was the second half of the question? One is long flares, and what is
the long flares, and can we do something to boost immunity?
And immune boosting, yes. So I'm going to address that first, actually. Absolutely no immune boosting, right? There are many people who think immune boosting is the number one thing that needs to be done. But if there is underlying, I'm telling you, more than 90% of children with autism that come into my practice have underlying PANDAS. And during COVID, so many families had absolute nightmarish experiences because they thought boosting immunity would be a good thing to do because, it's a special needs child and mom and dad always think for the best of the child. But unfortunately, that wasn't the case. Yes, so PANDAS, the immune system is already in overdrive in a bad way. And when you're using herbals, whatever supplements are out there, right, just be sure to look for immune boosters like echinacea, astragalus, eyebright, elderberry. Those should not be, hold on one second, sorry, because the sunshine is coming through and blurring the camera. But anyways, Yeah, I'm like right near the window. All right, so no immune boosting. What we need, because it will make matters worse, right? There is already anti-neuronal antibodies that are crossing the blood-brain barrier and attacking the neurons in the brain of the child with PANDAS. So you don't want to boost that. You don't want more antibodies to go attack the brain. So that's what needs to be done is regulation. Immune modulation is necessary. Okay, now let's answer the other half of the question, right? What do you do with long flares? With long flares, investigate why. What is going on? Why is this extra long flare happening, right? Flares, if there is a legitimate exposure, I have done a podcast on autism and PANDAS. Please watch that. It explains the mechanism and as to why once a legit trigger is acquired, like, strep, staph, flu, viral, mold exposure, insect bite, this legitimate trigger will trigger the PANDAS mechanism, and the PANDAS mechanism will go on for 4 to 6 weeks. That is the science. That is just how an autoimmune immune system works. You cannot do anything, other than stop the immune system, which obviously you don't want to do that, right? So how do you avoid long flares? The one thing that I had learned very early on with my son, because of the extreme severity that we were dealing with his PANDAS, was investigate every family member. Just make sure, if investigation is too much, if you have a large family, then at least treat other family members during their cough, cold, flu, so that, they are not being, so the child in question is not being exposed to those triggers. Mold avoidance, it's not just cleaning, right? Keeping the house clean is, I know, all families try to do the best they can. It's not a matter of cleanliness. It's a matter of, environmental toxins that can or cannot be seen. So that has to be properly investigated. Use your nose. Use your memory. Was there any water damage? Was there any water leakage? Same thing with the school. You can't do much with the school, but just keep your nose, eyes, ears all open to see what is going on at the school, so you know what the source is. And if you can do anything about the source, that's important. It's very important you can immune boost mom and dad, for example, right? So, if you have older siblings who are neurotypical, mom and dad, immune boosting can be done for them systematically, along with a few basic other supplements which need to be taken. I have a cold, virus, flu, cough protocol, which can be used by all the family members. It's very helpful during the season. So that is how you can prevent a long flare. The goal is to bring your child's immune system back on track and on a full herbal protocol. And that's when you'll see that your child gets a fever, but gets better within 1 or 2 days. Fever is great.
As we were talking about PANDAS, would you think it's possible, not PANDAS, because PANDAS is pediatric autoimmune, but have you seen in your cases a rise in adults with symptoms of PANDAS? Is it possible to have the same symptoms of PANDAS in the adults? And would it be, I don't know, you've mentioned about the protocol for cold and flu. Would it be something extra that we need to give to an adult that is showing symptoms? Or how can we protect, like, even neurotypical kids from a parent that is showing signs of PANDAS, which is not PANDAS, it should be ANS.
ANS. Right. Yes, I have done labs on on several parents just to, check on what's going on with them. Yes, many adults also have anti-neuronal antibodies, right? And, but with an adult immune system, during illness, immune boosting is good and it's fine, and for a short period. But during normal times, immune boosting is great, even better. Okay. Actually, this is confusing. Let me rephrase, right? Restart the answer. Okay. Now, with adults demonstrating PANDAS symptoms, during illness, do not boost. That's the best option. Okay. During active illness, follow the virus cold flu protocol. That will be enough to help you and your special needs child. But sorry, but by mistake, if you boost, it's okay. But it is best to not boost during illness. However, during normal times, when you're feeling fine, there's no illness, it is a great idea to use immune boosting so that you don't get sick. And adults can be boosted. It's not going to reactivate your symptoms. Not that I've seen. I mean, anything's possible, but usually I don't see that with adults because it's a mature immune system, and it can handle the immune boosting. The immune boosting is used appropriately. Now, I'm not saying drink 5 gallons of echinacea, to become Superman. No, or or Superwoman for that matter. I'm saying when dosed appropriately, the body will take what it needs as an immune booster and let go. Because remember, the adult detox mechanisms are matured and much better than the child's detox mechanisms as well. So that's what I've seen. And that is why there is the adult protocol, which has the immune booster in there, which is, helpful to the other members of the family.
We've got another questions from Nicoletta. She's from the UK, parent of an autistic child. And she's asking, is there a cause or a link between epilepsy and puberty in the autistic kids?
Interesting question and a good question. To me, it seems like if a child is developing hormonal associated epilepsy, that means that there is brain inflammation with underlying causes, comorbidities that has not been treated. So brain inflammation along with viruses, viruses can cross the blood-brain barrier. We often see them as positive in one of the labs that we run for the brain autoimmunity. And so, to me, this will say that underlying comorbidities have not been treated. That is why when there is hormonal surge, the brain inflammation goes into overdrive.
Food sensitivities. If a child is expressing severe food sensitivities, what's actually happening as a cause to that child? And how can we sort it out? Okay. I really don't have the labs to say exactly, but what could be the causes for underlying food sensitivities? Sorry.
Severe food sensitivities is the question. And why is it happening?
Yes.
So severe food sensitivities, please don't say that, oh, this is autism. Autistic children have a leaky gut, yada, yada, yada. It's fine. We have to manage. No. Leaky gut, very much true. But, why leaky gut? It's not just because it's autism, so your child was magically given the diagnosis of autism and magically the gut became leaky. No. There's always underlying causes. Investigate those. Now, what happens is when there is microbial, now microbial can be, fungal, parasitical, yeast, mold, bacterial, viral, right? So any of these, gram-negative bacteria, gram-positive bacteria. So they release toxins, endotoxins, and lipopolysaccharides. Now, lipopolysaccharides, endotoxins, they poke holes in the membranes in the gut. Now, when there are these microscopic holes in the membranes of the gut, then the food that the child eats that is supposed to be in the gut escapes through those tiny holes. And when the food particles, molecules, I should say, not particles, it's very tiny. When these molecules end up in the bloodstream or outside of the gut, many times the already overactive, or even if the immune system is normal, not PANDAS overactive, it usually is, but even if it's not, it will attack these molecules because they are alien to the bloodstream. They are not supposed to be in the bloodstream. Okay, so that is one reason why there is severe reactions, food sensitivities, because your immune system is overreacting. Second is when there is a leaky gut and you have these endotoxins from whatever is happening in the gut, these endotoxins can translocate to other major organs. Now, the other major organs being the liver, the spleen, the kidneys, and I've seen children develop, childhood kidney disorder, childhood nephrological disorder, childhood liver issues, fatty liver disease. Even in adults, this can happen, of course. So that is the other reason, right? So if liver is involved, then you have digestion issues. If kidney is involved, then you have water regulation, electrolyte, mineral imbalances that are seen in the body that have their own consequences as well. You'll see that the child is very tired. You see moments where your child is bright, but then you'll see that, there are moments of great brain fog. It is simply nutritional deficiencies. So unless your child is having an anaphylactic true IgE allergy to that food and having only multiple sensitivities, which is demonstrating as eczema, other kinds of symptoms, then you should definitely investigate and treat.
Thank you. I've got a question from someone, I don't know their name, but it says she's supposing that her child could have Lyme, although it was never bitten by a tick. She has listened to your podcasts and she's got the question: if a child shows autistic symptoms, let's say because of the Lyme that he's got from the mother, from the mold in the house, biotoxins, pesticides, heavy metals, and every other single way, then how is it possible that two brothers living in the same environment, born from the same mother and father, one is fully healthy and the other one is autistic?
Again, interesting question, right? Even twins are different. So just regular siblings are obviously different. So that is a no-brainer. I see that all the time. Triplets are different. It's very interesting. One set of triplets that I see, that just reminds me, the firstborn, the one who was born like a couple of minutes earlier, is fine. Completely neurotypical with like minimum, issues, or hardly any, you can say. And the other two brothers that came after as part of the triplets have issues. And even then, one of them has more severe, PANDAS, vaccine injury, autism-like syndrome issues than the other one. So I see this at every appointment. One is developing better than the other. They're twins, identical, triplets. So they each have their own protocol. So that is how that is possible. They're two different individuals. What else? What was the question about Lyme? What were
No,
can
she
Lyme cause
said that-
autism?
Yeah, no. The question was like if they are brothers and everything should be the same, the environment, the food that they consume, and everything else. How is it that one is autistic and one is not? How
Oh,
can-
right. Okay. So
like
the
confusion?
so who is autistic? The older or the younger?
The younger.
The younger one is autistic. Okay. Yeah. So I think I already answered the question. You know, it could be any number of things that went wrong.
Thank you.
Child.
Dorina from Germany is asking about increased IgG antibodies. For example, if the IgG limits of a virus is less than 10, let's say, and the lab is showing that that IgG is over 500, how do you explain those markers? How dangerous are they for the body? And how can they impact the body?
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.